Hi, I'm Dr.G.P.V.Subbaiah, spine surgeon, Hyderabad. Low back pain is a very common problem, and one of the most common causes of low back pain is a disc pathology, whether there is any degeneration in the disc, so that can cause low back pain. But the second most common cause of the back pain is what we call spondylolisthesis. So spondylolisthesis is nothing but slippage of bones over each other in the lower back. If you look at the anatomy of the lower back, the spine, the bones in the lower back, what we call them vertebral bodies, and they are arranged over each other like the bricks in a wall. So if there is malalignment of these bones, that malalignment is called spondylolisthesis. So what are the causes of this spondylolisthesis? It's a very common problem we see in our practice, and of all the types of spondylolisthesis, the most common one we see in our practice is what we call a degenerative spondylolisthesis. Degenerative spondylolisthesis is nothing but as the age progresses, the wear and tear sets in the body. So the wear and tear happens in the lower back also, and this wear and tear process is what we call a degenerative process. So this degenerative, the wear and tear process causing slippage of the bones is what we call a degenerative spondylolisthesis. This is the most common type of spondylolisthesis we see in our practice. And the second type we see is what we call ischemic spondylolisthesis. Ischemic spondylolisthesis is nothing but, if you see the bones in the back, there is a connection between these two bones, and this connection is what we call pars interarticularis. And if there is a break or a defect in this pars interarticularis, so that can cause slippage of these bones. And this type of spondylolisthesis is known as ischemic spondylolisthesis. So degenerative spondylolisthesis and ischemic, these two are the most common types of spondylolisthesis we see in our practice. Third thing is what we call post-traumatic. So you met with an accident, and that accident, if it breaks the bone, the connection between the two bones in the lower back, so that can lead to slippage of bones. This is what we call post-traumatic spondylolisthesis. And the fourth type is what we call a dysplastic type. Dysplastic means if there is a defect in the development of the bones, either in the vertebral bodies or the connection between these two bones, so that can lead to slippage of the bones. This is what we call a dysplastic type of spondylolisthesis. So other type which we see is what we call pathological type of spondylolisthesis. Pathological means, say for example, if there is a tumor or if there is an infection which can create a break or defect in the bone connecting the two vertebral bodies, that can lead to slippage of bones. So this is what we call pathological type of spondylolisthesis. The other common variety we see in our day-to-day practice is post-operative spondylolisthesis. This post-operative spondylolisthesis means, so while doing surgeries on the lumbar spine, the lower back, sometimes you can break the connection between these two vertebral bodies. So this can lead to spondylolisthesis over a period of time. So these are all the causes of spondylolisthesis. The most common type we see is degenerative, the age-related, ischemic type, post-traumatic, dysplastic type, pathological type, and post-operative type. So these are all the causes of spondylolisthesis.